Welcome everyone to today's webinar, How to Successfully Navigate the AI and Automation Landscape. I am Aaliyah Pavla with Becker's Hospital Review. We will begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We are looking forward to hearing your questions. We will also have a series of audience polling questions during today's webinar. When we reach each poll slide, the poll question will pop up automatically on your screen. Our speakers will give a few seconds for you to select an answer from the options on your screen and click Submit. Thank you in advance for your participation. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. At this time, it is now my pleasure to start today's webinar by introducing our presenters. Ross Moore is the General Manager of Olive's Revenue Cycle Practice. He has over 10 years of experience helping healthcare providers improve their revenue cycle through the implementation of automation and AI solutions, operating model redesign, and change management programs. Ross received his MBA from the University of Chicago and his undergraduate business degree from the University of Notre Dame. I'd also like to introduce Sue Whitecotton. As VP of Patient Financial Services at Medstar Health, she oversees the revenue cycle for Medstar Health's 10 hospital facilities. The areas of operations include insurance verifications, authorizations, billing, collections, financial assistance, and reporting. Medstar Health is a nonprofit health system dedicated to caring for people in Maryland and the Washington, D.C. region, with an additional focus on advancing the practice of medicine through education, innovation, and research. At this time, I am pleased to turn the floor over to Ross to begin today's presentation.
Thanks, Aaliyah. This is Ross with the Olive team. Thanks for joining us today. I know everybody's got very busy schedules, so we appreciate your taking the time out of your day to be able to join this webinar. Really focused on enterprise operation is going to be the topic of today's conversation. You can think of today as an automation 101, 201, and really 301, if you were thinking about in terms of the courses, all baked into one session. And by that, I mean, we're really going to be trying to share insights and tips for the group that are going to be helpful for you all, regardless of where you are and your experience with using automation. Sue will get into this a little bit more, but she's really lived and breathed the automation experience for the better part of 2 years now. So she's going to have a lot of information to share about Medstar and their automation program. Just a little bit more about my background. So I've been in the automation and revenue cycle space, particularly for the better part of about 10 years. Started my career at Huron Consulting Group, and then moved over to Accenture and the revenue cycle leadership team, where I was really focused on bringing automation to healthcare providers. So doing things like standing up automation capabilities through a center of excellence. And then more recently, I've joined Olive as our general manager for revenue cycle solutions. So really focused on bolstering the automation capabilities that we're bringing to the market. And Olive offers more of a AI as a service model. So that's what we're going to be talking about today. More holistically, what are the different models that you can use for adopting automation, whether you're going to be building your own capability or partnering with somebody that offers it more as a service, and what are the benefits and then perhaps some of the drawbacks to some of those are in consideration. So as we're thinking about the learning points for today, again, just want to stress that it's really going to be agnostic. We're not just focusing on Olive. We're talking across the spectrum. What are the different approaches that can be taken for automating within your organization at an enterprise level? And by the end of today's conversation and the webinar, everyone in the audience should have the ability to really understand and evaluate as well. What are those different adoption approaches that you can be taking? We think about the organizations that are adopting automation really three different kinds of archetypes. So we'll show that in what we're calling the maturity model a little bit later on. But either the information gathering stage, program kickoff, or really enterprise solutioning and adoption. The other piece that we can't stress enough is just the importance of gaining enterprise support by really having a strong governance system that's in place and engaging the right stakeholders across your organization. And then we'll spend some more time as well highlighting what are ways that you can really benchmark your program, so that way you can understand what both the financial impacts are as well as the operational impacts to your organization. So the reason why automation is becoming such a popular way of re-engineering or redefining your programs is because of a few different things. So some of the challenges that I think we all know really well are the labor costs. So increases in wages, as we're seeing a tightening of the labor market, is a real thing. But you could think of it in terms of both the hard costs that are associated with wages that are increasing, as well as the turnover and the training costs that are associated as well. So I know I'll consistently use revenue cycle, but automation can definitely be applied in other areas of the organization as well, like HR, supply chain, finance, and even in the clinical settings as well. But due to the turnover that we typically see in some of the functions that are the best candidates to be automated, using an enterprise approach to be able to develop automation capabilities can really help combat some of those challenges of the rising labor costs. Increasing complexity of workflows is definitely another area and a big reason why we see folks want to adopt automation. It's getting harder and harder to get claims out the door, billed, and paid cleanly. So when you're using automation, you can really build the processes with the end in mind to make sure that you're really being able to drive to the highest reimbursement and really being able to offset some of those pressures that we're seeing in the market right now. Other areas, Ricky, you can also use it to kind of tie into the reimbursement side is with capturing charges as well. So you can not only use it for doing things like managing your denials and doing some of the eligibility and authorization workflows, but also more upstream with your charge capture programs. You can use automation to be able to help make sure that the right charges are getting on all of your claims. And the last piece where we're seeing challenges is within the healthcare environment and ecosystem, there's a consistent thread or trend of consolidation and acquisition. So with that becomes more and more disparate IT systems and your work drivers. So what ends up as a result of that is you may have several different EHRs that are in place at your system, and you can use automation to really help drive some more sustainability as well as standardization across the enterprise. So I talked about this a little bit in the previous slide, kind of tying them together, but again, these are really the ways that you can use automation to be able to help meet those challenges that you have at the end of the day. So I'm going to spend a good amount of time on this slide with the automation adoption maturity model. There are really three different archetypes or types of organizations we see as you're evaluating and then adopting automation within the enterprise. And this is important to think about for yourselves that are on the line because after this slide, we're going to have a polling question because we want to be able to get a better sense of where your organization fits in this maturity model. So that way, as Sue's talking about the Medstar journey, as well as when later on I'm talking about some of the common pain points and how to address those pain points, that we can really tailor the content and tailor the speaking points based off of where most of the people that are attending this webinar are going to fit. So if we're looking on the left side there with the information gathering, this is really at the very beginning of the journey. If you're very, very dedicated to adopting an automation capability, we typically see this unfold over maybe a 1 to 2 month period, but it could stretch much longer if your organization is still kind of testing the waters and isn't fully dedicated to bringing this capability on board. So as we're looking again at that first stage in the information gathering, really what I would argue is the most important component of this is making the determination on what kind of operating model you want to use at the end of the day. And so by that, one of the easiest ways to kind of boil that down is making the decision for whether you'd rather build the automation capability or if you'd rather buy the automation capability in a sense. A couple different flavors to it, but and it varies based off organization, what's going to make the most sense for you. So if your organization has a high importance on wanting to have automation be your core capability, and you want to make sure you're building that out in-house, then you would really be looking at more of that building the capability. So some of the technologies that play really well into building it would be, for example, I'd call them the big three: your Blue Prisms, your UI paths, the Automation Anywhere is another big one, and then we also see technologies like WorkFusion or Boston Workstation be other ones that are used pretty regularly in the healthcare space. But within that building approach, you could either kind of build that capability on your own, where in order to do that successfully, you need to be able to bring in resources that really have experience building on one of those automation platforms that I just mentioned. Or you can partner with an implementation partner, typically your larger consulting firms that have been doing this in other areas, maybe like financial services or on the insurance side for quite some time. So they can help stand up that capability, so that way you can get a couple of the automations going and then train your team how to mine for those processes, as well as then build and maintain. The other approach that can be taken in the market is more of the buying approach, you could say. So using AI is more of a service, where you're working with a firm like an Olive is where we play, to be able to do end-to-end the process mining, setting up the governance structure, working with your team to prioritize, do the business case around each of those processes, do the build, and then do the maintenance as well, all in more of a subscription fee type of approach. So those technologies definitely go hand in hand with the operating model determination that your team is making. And again, it just varies based off of what your preferences are as an organization, also how quickly and reliably you'll be able to get some of the skilled resources that would be needed if you're going more of a builder approach, and again, maintaining those as well. So as you're in this first phase, there's also a really heavy focus on assessing those different use cases. There's definitely not going to be a shortage of different areas and opportunities there are to automate, and I'll talk about that a little bit more in that second phase here with the program kickoff. So again, that's really the first phase there, is thinking about what is the operating model you want to use, and what's the technology that's going to make the most sense based off of that model that you're picking. The second bucket here is what we call more of your program kickoff. So you may have an AI worker or a couple of workers, in the sense that there's probably anywhere from 1 to 10 bots that are live. Typically a bot, I mean, on the faster scale or the faster side, could be built in anywhere from 4 to 6 weeks. But that depends on complexity. If you're targeting a more complex processes where there's a lot of handoffs, or if there's maybe some, you may have to use machine learning in order to make the determination. So leveraging some more of those cognitive capabilities, those are definitely going to take longer than the 4 to 6 weeks, and could be several months it ends up taking. So typically we see organizations stay in this phase of that program kickoff for anywhere from about 1 to 6 months. So during that phase, as I was mentioning, there's going to be no shortage of different automations that are being identified. And what's really, really important is that you're picking the right processes. So making sure, it becomes very important to make sure that you're really measuring what that impact is going to be. You're thinking about what are the impacts to your labor. So for example, what are the FTE equivalents that would be equating to the work that's going to be done. What's the impact to your gross revenue? So if it's more of a charge capture related process, what's that top line impact going to be? What's the net revenue impact going to be? So preventing denials and write-offs at the end of the day. It could also be in terms of customer experience as well. You could use automations to be able to do some more of the customer-facing capabilities, like a chatbot, for example. So you could see that in some of your customer experience scores. Or it could be also in terms of cash acceleration. So really becomes important to evaluate across each of those different levers what that impact is going to be in order to figure out which processes are going to make the most sense. And as you're starting off the program, it becomes even more important to make sure that you're finding that right balance of complexity. So if you're trying to get a couple of quick wins and get just automation going, so that way you can get some learnings, then maybe picking some of the easier processes and really considering that speed to scale. And so then once you have a couple of bots live and you're really looking at that third bucket and then shifting over to enterprise adoption, that's when you really start getting into a scaled AI workforce where you really have an army of bots. So 10 up to 100 plus bots that are in production at the end of the day. So we call that more of an army of bots, so to speak. So as you're looking in that third phase, the governance is going to become really, really important to make sure that you're effectively able to scale your workforce. So as we're thinking about governance, there's a couple different pieces to it. First off, you want to make sure that you have a really, really strong executive sponsor. So ideally, somebody at the C-suite level, maybe the CFO or a CIO, are typically the executive sponsors that we would see helping to really advocate for the program. And the reason why that's so important is because these programs are really spanning across all the different areas of your enterprise. So there's going to be heavy coordination that needs to be done between your operational teams as well as your technical teams, so IT, in order to help get some of the bots maybe provisioned. There could be integrations that are required where you have to get information out of your EMR. So as a result, it becomes really important for that governance to, again, have that executive sponsor that's going to be able to go to bat for your program and then be able to make sure that this is a high priority, that people are giving the time of day and are sharing the information that's needed in order to mine the right processes and get the build completed. And then the second piece is thinking about, again, who are the right stakeholders that you need to be engaging across the enterprise. And the teams are going to really be focused on IT. It's going to be your finance teams that are engaged, like the revenue cycle or more like pure accounting and finance kinds of functions. Outside of that, the compliance department is going to have to be engaged as well. So again, making sure that it's a fully encompassed governance model. And Sue's going to give a more detailed example of how that's being deployed at Medstar. In this last bucket as well, for adopting an AI at more of an enterprise scale, it becomes really important to have the right change management approach around your program too. So when you're thinking about change management, you think about it in terms of how do you want to be communicating and positioning your program. There can be a lot of misconceptions about what's going to happen to the organization, specifically staff members, as AI and automation is being adopted. So it's important to get ahead of that, to have your executive sponsor, have your leadership team align on what are the key talking points. And I think Sue's going to talk about this a little bit more with Medstar, but what are those key talking points and components of the program, and making sure that the leaders are really communicating it in a consistent manner. And there's no one size fits all best communication method, and having those pillars be the same across everybody. What's important is to make sure that it's tailored to your organization, because every organization has a different culture at the end of the day, and it just, again, needs to be aligned with that. But as you're, again, looking at this third bucket, that the last piece that really starts coming into play more and more are focusing then on the more complex automations that are going to be requiring machine learning. So one example of that could be if you're building out the capability to basically predict denials before they're even happening, and then you're leveraging a bot or your automation capability to then act on that information and knowing that a denial may be taking place, and then correcting the claim kind of autonomously on its own before it actually goes out the door. So those are the more complex ones that you should be thinking about, how you fold in your operation as you get a little bit more mature into the program. And then thinking about how you can leverage capabilities where there's more of a neural network in place. So one of the things that we do at Olive is we will have shared learnings where when one of our bots learns about a different process and get smarter, pick up on a payer trend, then anybody else that's on the network then gets smarter as well, because that learning automatically gets applied. So thinking through how you can use some of those more complex capabilities as you're unfolding as well. So I mentioned earlier that there's a polling question. Now that we've talked about those three different archetypes, again, the information gathering, the program kickoff, as well as the enterprise adoption, we wanted to get this group's feedback on where exactly is it that your organization fits. So Aaliyah, keep me honest here, but I believe the audience has the capability to go ahead and submit their answers. We'll give you a couple more seconds to get in the portal and submit your responses before looking at the results.
Yep, you're absolutely right.
Okay, we'll give it a 3, 2, 1. All right, we'll close the window here and go to the results. So this is interesting. It's good to see. It's definitely reflective of where the market is right now. I feel like in terms of an inflection point, you have, if you were thinking about it in terms of like an industry adoption model, a lot of organizations that are still in this information gathering phase, maybe looking at a couple different technologies, perhaps even doing like a proof of concept where you're just automating one component of a process, whereas others are more in that program kickoff. And then it's interesting, I think that's a good insight, that there are more that are in this enterprise adoption phase relative to being in the kickoff. So if we were to do this a year from now, I think that we would see much different results that are showing up in terms of people shifting from info gathering to being in those second and third buckets. And thank you for sharing that. That's good, so that way we can tailor our presentation to those different pieces and maybe more focusing on the information gathering. So I'll pass it to Sue now to talk about the Medstar journey.
Hi, good afternoon. I'm here today to share my experience with Olive, and let's start with a little bit of background on Medstar. It is based in Columbia, Maryland, our corporate office. It is one of the largest healthcare providers in Maryland and the DC region. We employ over 30,000 associates with 2,500 employed physicians. We do $5.6 billion annually in net patient service revenue. I have responsibility for the revenue cycle operations for our 10 acute facilities for the hospital billing side, in addition to the 53 outpatient locations in our national rehab network. We started centralization back in 1997 on both the hospital side and then later on our physician side as well. We use Cerner, EMR, and on the revenue cycle side, we use Envision on the hospital side and IDX on the physician side. So to talk a little bit about our journey, as Ross mentioned in the 3 categories, the information gathering category, we started back in 2018, early 2018, really embarking on information gathering. We had started learning more about the automation with the RPA and artificial intelligence, and our finance team got together and decided it was something we wanted to explore a little bit more to understand where we had opportunities to decrease costs and increase our efficiencies. So we started on our journey educating ourselves, first reaching out to some of our partners who were already doing some of this, and they came in and did some presentations. And then they aligned us with some other providers who were starting to dabble in the market that we went and did some site visits as well as some reference calls. So the finance team and started to put that together, and we decided to pilot this in our accounting and our AP department, as well as in our revenue cycle. So we did an RFP and started our vendor selection process. And again, Ross talked about the two different models, and that was very much what we saw, more so on the first model being that you go out and purchase your own software and partner with someone to come in and do help you identify and build, and then train your team either to take that over or you to have them partner with you to take over that service. And then we saw the Olive model, which was very different than everyone else, where we really paid the subscription fee and then partnered with them to really do all of the work with the building and the maintenance of the bots. So at the end of the day, we decided we were actually going to try both models and pilot the AP and the general accounting with the first model, and revenue cycle decided they were going to partner with Olive and do our proof of concept and see where we ended up. So once we got through the contracting and all the security clearance that we needed to do, we started to do our kickoffs. And at that point, I needed to get my team engaged. I needed to get them involved in understanding this new concept. So we brought the Olive team in, and we did a kickoff meeting to really engage the leaders. And we challenged them to go back to their teams with the questionnaires that they provided and identify 2 to 3 pilots from each team and bring those back a week later. And they did that, and they presented their ideas over the course of 2 days to the Olive team as well as our leadership. And from that, we identified 13 pilots on the revenue cycle side for both hospital and physician side. And we completed our year 1 roadmap with target dates for completion of those processes. It was important for us to have a quick win. We realized you can have quick wins and you can have big wins. We wanted to start out with a quick win because we really wanted to really get the trust of our teams on board. So we targeted a eligibility batch process that was able to be built and completed within a 4-week time frame that historically took approximately 2 to 3 hours per day for a staff member to review this report that came back looking for eligibility on patients that might have been missed at registration and updating the system and getting accounts rebuilt. Olive is able to complete that in 20 minutes per day. So that went over really big, was really successful, and really started getting the team pumped up and engaged. We then moved on to some more complex builds that had much bigger wins. And again, another part of our eligibility process was our central financial clearance that we do for all of our scheduled inpatient and surgical patients, where we had a team of people that actually worked from this schedule that created a pre-registration in our Envision system that created workflow where they would go in and do the eligibility checking along with doing the price estimation and calculating the patient's out-of-pocket cost to then pass that back on to the other 2 teams to do the pre-authorization and the pre-visit, pre-collect process. Again, that was much more complex. It took us a little longer to build, and we had to work out a few kinks, but has been very successful since we've gotten that underway, and I'll talk a little bit more about that in detail. And then we continue to build out. We completed 5 more workflows through the June timeline. So again, starting in January, ending in June, we had 6 pilots up and running. And at that point, our finance team, along with our CFO, started to really engage in the Olive model and decided to pursue an enterprise approach to this and started our discussions with Olive. We also went out and did presentations to various leadership forums, as well as monthly updates to our CSO councils. So how does Olive work? The eligibility workflow that I just mentioned earlier, patients are scheduled in our surgical posting system, which then creates a pre-registration in our Envision system that we have integration into another system that creates our workflow. Olive actually works just like one of our other staff members. They're credentialed to sign into all of our systems. That workflow is sent to Olive each day. It's real time, so as patients are being scheduled, that work list is being updated daily, throughout the day. So Olive refreshes that every hour, and it resorts the data so that we have the oldest services first to be done and to the newest services. Olive, through our registration pathway, then has the ability to initiate an HDX query and response for those payers that have ability to check through HDX, and also has ability to go in and log into the portals for those payers that we do not have through the HDX response. Olive verifies the benefits, make sure the plan codes are correct, and that's a big win for us because oftentimes what we were seeing is the response was being read incorrectly by the staff. So as an example, if we had a Medicare patient who was actually enrolled in a Medicare MCO, oftentimes the registrar or whoever was doing the scheduling would put in the Medicare fee-for-service plan code and not the Medicare Advantage plan code, and therefore could have some downstream impact with regards to denials. So Olive was trained how to read that correctly, match it against the plan code, make sure the appropriate plan code is in the system, and then if not, to update that. And then Olive reads the benefits, make sure that it is effective for the dates of service, what the out-of-pocket cost is going to be, and any copays associated with that service. Olive then takes that information along with the CPT code that was posted for the procedure and runs that through our pricing tool to price out that procedure. And then from there is able to calculate the patient's out-of-pocket cost associated with the benefits and the cost it received through the eligibility process. Olive then documents that in the notes in the system and the Envision system, and then pushes it to both our pre-auth team and our pre-visit team, where they can continue to work that. The advantages there is we're getting in front of it now, where we have more time to make sure the authorization is secured and more time to work with that physician office if it's not, as well as more time for our pre-visit team to reach the patient and inform them of any out-of-pocket cost, do any pre-collect, or answer any questions for the patient, enhancing the patient experience. And then lastly, it also provides the teams more time to escalate to the facility if either one of those processes are a problem, so that the facility has more time to make a more informed decision about continuing with the services. And then, like any other employee, we get a report each day on what Olive completed, and that allows our management team to make sure that the work is being done timely and accurately, and it gives you a audit trail if there's any issues that you can refer back to. So some of our key results from that. One of the reasons why we selected this process was because we could never meet our goal. Our goal was to be 2 weeks out and have 90% of our work completed. On average, we were only getting about 70% of that work completed in that 2-week period. Obviously, because you have a lot of things that are scheduled less than 2 weeks, so it was like pushing sand against the ocean. It was just very difficult for the team to keep up with that volume of work. Olive has now been able to work 3 weeks out and is completing on average 90% of that work on a daily basis. Again, that's leaving more time for our pre-visit team and our authorization team to complete their work, with Olive working 4 times faster than any of our staff. And that resulted in $350,000 in labor savings, which was equivalent to 6 FTEs in that area completing that work. Ross talked about the governance structure, and as we expanded this through the enterprise, we really thought it was important for us to have this structure in place. Again, with the executive sponsor being our corporate CFO, and having representation in our advisory council to include revenue cycle, obviously bringing together the expertise that we had learned thus far and to be able to support the other areas. We have IT representation with our CIO at the table. We have a finance leader there, making sure that the teams are being held accountable for both the implementation and the cost reduction. We have supply chain who worked with us on the early stages of the process as well, and then performance improvement to help any team with any design or redesign that's necessary to implement the Olive processes, and then HR to help with any change management that might be necessary. Along with the Olive team that includes their Alpha team leads and architects and engineers that have bi-directional communication reporting with their Omega teams. This committee meets every 3 weeks, and they review any new processes that have been identified for approval, as well as review the in-flight processes and make sure they're meeting their timelines, as well as holding, again, leaders accountable to make sure that the implementations are getting done and they are meeting those hard cost reductions. So on an enterprise scale, we've identified 137 CPAs, and to include areas in HR, supply chain, case management, utilization review, and the oncology department. Some examples of those on the oncology side, authorizations has been a challenge for us on drugs. As you all know, they're high-cost drugs, and they can change throughout the course of treatment, and sometimes they get lost in with the orders, and they don't get back to the team to get the authorization. So we're setting up a process that through the charge order that we'll be able to look at the authorization and match it with that CPT code to make sure that authorization is on the list. And if not, send it to a work queue for somebody to do that prior to the billing. HR is looking at using this for employee onboarding. And then on our case management side, we're really excited about this opportunity because another area of challenge with staffing turnover and just keeping up with sheer volume is uploading clinical information on concurrent reviews into the payer portals. We've already had 15 workflows approved. They include areas in revenue cycle. Again, we continue to do our discovery phase in round 2. We identified 43 workflows on the Part A hospital billing side and an additional 32 on the Part B side. And then we're switching out the work that General Accounting and Accounts Payable did on their pilot through their model onto the Olive pilot. And these examples include journal entry uploads, anesthesia charge entry, claim status, and cash reconciliation, just to name a few.
Perfect. Well, thanks, Sue. I think that there's a lot of lessons that can be learned and best practices that are pulled out of Medstar's story. So kudos to you and your team for really being able to go through each of these phases successfully and get to this scaled approach now where you're truly adopting it at scale and then continuing to look for new ways and incorporate new ways to use automation, especially in other areas of the organization. I think that has a nice tie into this slide as well for setting yourself up for success and really trying to avoid some of the most common pitfalls. So one of the industry stats that's out there, I think it was a Deloitte report that went out, analysis that was done, but there's on average about 50% of automation programs end up failing. And the reason for that is really it kind of boils down to these four main pieces right here. There's a lot of focus and time that goes into building automations and building the bots, regardless of what model you're using, whether you're building your own or you're working with a partner that can do it with you. But after those bots are live, there's a pretty significant amount of work that goes into the maintenance on those bots, because it depends on how fragile each automation is and what kind of automation you're doing. So, for example, there's automations that use what's called computer visioning or optical character recognition, OCR. So if you're looking through scanned images, for example, or you're having to go perhaps through like a Citrix portal to be able to get to your EMR to get information, it's not uncommon to have to use some of those capabilities like OCR to get the information extracted accurately. And as screens are constantly shifting or websites are constantly shifting, that does require maintenance. So it's really important as you're looking at your automations and you're building out your capability, that you're planning for the fact that your builders are not going to just spend time doing build. There's also going to be technical resources that need to be fully dedicated to doing the bot maintenance as well. If we're looking at the second piece here with the governance, I think Sue did a really good job talking about the model that's being used at Medstar, having monthly executive updates, governance meetings every 3 weeks. That's also tying into change management. So one question I had for you, Sue, is could you talk a little bit about how Medstar is approaching communication and communicated your program to the organization?
Sure. So again, we have been in front of many leadership forums presenting the results from our pilots and the next steps to engage other areas as well. We do monthly updates at our CFO Council. But more importantly, we've done a mass communication from our executive sponsor out to the entire enterprise, communicating the Olive Initiative and engaging all of the areas and challenging them to come up with ideas. And then actually going out and doing discovery sessions with those different areas that have expressed interest and targeting areas where we have big initiatives. For example, in our denials arena, we have an enterprise work group working on that over the last 2 years, and we now have Olive as an item on those agendas to reference and look for opportunities to use, such as the oncology drug authorization issue, that we can keep Olive out there and keep it in front of people so that they're getting more comfortable with it as we did.
Perfect. Thank you. And I think that ties back to as well, being able to generate a lot of interest and excitement within your organization by focusing on some of those quick wins up front. So that way you can then use that as kind of your podium to go out there and speak with other areas of the org and say, this is how much success we're having with this department that we focused on, maybe it's revenue cycle. So that way, again, they can be thinking, well, how do I use automation in my organization to be able to really achieve some of the outcomes that we haven't been able to get to in the past? So as you're looking then, on where do you go from here, we wanted to leave the group with some of these questions to kind of ask yourself as you're unfolding in your automation journey. So for example, I know a lot of the group is in this information gathering stage, definitely recommend just starting right off the bat of considering what's going to make the most sense for our organization, whether we want to be more of a builder or we want to be more of a buyer and using AI as more of a service. It's going to also come down to, for that determination, how likely is it that you're going to be able to get some of the technical resources that are onboarded and trained pretty quickly to be able to do the automation? Because if you're working with an implementation partner, they'll be able to help you with the build initially, but the long term is if you're going that approach of building, you want to be able to maintain those and then scale those on your own. And it's a very different skill set that's required relative to what skills and capabilities many of the people have in the organization. You're thinking you may have to get people that have more of a computer science or like an engineering background that are going to be better fit for these kinds of roles. So then it becomes also like a more of a recruiting kind of question, and then making sure that, again, you can kind of sustain that on your own. So another big thing to focus on in this information gathering phase as well is if you are going more of the builder approach and you're working with somebody as an automation or an implementation partner, definitely make sure you're doing a lot of the vetting to figure out how much experience do they have, specifically with healthcare, working with a provider organization, and being able to bring automation, mine for the right processes, do the build, and build it in a high-quality way. So, for example, I know that in Olive, we've worked with about 70 customers now, and where we were in the beginning when we'd worked with maybe 5 customers is a lot different than the insights and the lessons that we'd learned compared to now being at 70 customers. So, for example, Sue mentioned that Olive does the work for eligibility very similarly to how her staff was historically working it. So there's definitely processes where it makes sense, where you'll train a bot to basically do the exact same process using the same exact steps that a person was in the past. But then as you're working with more experienced partners, they can think through ways that you basically leverage the best capabilities of the bot, which is really a computer at the end of the day, and how to replicate your processes, having that bot work as a computer versus as a human. So one example of that could be like claim status, for example, going to a payer website, having to log in and get the information individually one at a time. You could have a bot do that, but a better way to do it is basically have the bot interact with the objects, and I won't get too technical, but you can interact with the objects that are kind of behind the screens of that website to be able to send packages of information to that website and then pull in a much more rapid manner, in a much more sustainable manner as well, where you're not having to screen scrape, getting the information on that claim status and then pushing that information into your EMR. So that way you could even do some actioning on that as well. Maybe it's reprioritizing accounts, maybe it's actually doing a bill correction and resubmission. But the key thing there is thinking through ways that you could either have to replicate the exact process or augment the way that the process is working. We're getting a little shorter on time, so I won't go through all of these different questions, but I know that there's a bigger bucket too in that third area with the AI workforce. So the biggest thing is you're scaling the program. I think we talked a lot about the governance and how do you get to new areas where you can automate. So Sue talked about that quite a bit with Medstar, but what we haven't hit on as much are the kind of those first and third questions. How are you making sure that your bots are getting smarter over time? So always running the analytics to be able to see how long are the plans taking to run, what's the effectiveness rate, and then being able to dig into having a higher yield, because kind of like a person, you may start off with a process built one way and it has, it's 90% effective, but there's a big difference going from 90% to 100%. So having that be a core focus as well of getting better at how those bots are operating as time goes on. And then thinking through how are you going to manage that AI workforce. So what are those metrics that you're using? I like to think of it in terms of more bot operational metrics versus more organizational financial metrics. So on the first side, for the bot metrics, it's thinking about stuff like the effectiveness rate, what's the uptime. So are your bots constantly running and not running into issues where they're failing and somebody's having to then go in and then end up having to do the work at the end of the day, versus more of the financial metrics that are impacting your organization. It could be AR days. So how well are your bots allowing you to accelerate cash at the end of the day? It could be your denials. So are you truly impacting write-offs? It could be how far out you're doing insurance verification, like Sue was talking about. So being able to think about it in terms of those two metrics to help metric types to help manage your AI workforce a little bit better. So with that, I know some folks have been submitting questions throughout the day. If there were certain questions that you have as well that we didn't get to, by all means, put them into the box here. Feel free to follow up, and we're happy to send more information, help answer your questions, so that way you can make sure you're getting everything out of this webinar today that you were hoping to get out of it. So with the Q&A.
Thank you, Ross.
Yeah.
Thank you, Ross and Sue, for that fantastic presentation. We will now begin today's question and answer session. Please submit any questions you have by typing them into the Q&A box you see on your dashboard. We will try to get through as many of the questions that we can in the time that we have left. So I will direct the first question to Ross. And an audience member is asking, what is the typical scope of initial AI workers deployed during the program kickoff phase?
Yeah, it's a good question. So I think it ties back well to the story that Sue was telling in terms of being able to get quick wins on the board. So that way you're able to get your program moving and you're able to share those results with others. So I'd say I call them the big three in terms of typical areas to focus on. And I'll talk more on the revenue cycle side, just given that I think most of the folks that are attending this session and traditionally are joining through Becker's are within the rev cycle teams. But those big three areas would be eligibility, so doing the kind of process that Sue was talking through. Another area is with authorizations. Specifically determining if an authorization is going to be required on a service, as well as statusing to be able to say, now that this auth has been submitted, what is the status on it, and then getting that authorization number into your EMRs and capturing a screenshot, let's say, for example, of that authorization that was approved. So that way you can then refer back to it if you get a denial later on down the road, and then you need to be able to provide that as proof that this service was authorized. So authorization, determination, and statusing would be two areas that are pretty common to focus on. Submission is a little bit tougher and would be further down the line just because you need to have some of the clinical documentation and justification. And then the third area is around claim status. So I know there could be a number of staff, an army of staff that are focused on going out to the payer websites. They're checking the status of the claims. Many times they're kind of fruitless in the sense that they check, still processing or still pending. Okay, let me go back and put a note in. So you can accelerate that and make sure that your staff are getting the highest return on each touch by having a bot basically go out, check those statuses. And I know that there are capabilities through EMRs, typically through some of the 276, 277 transactions, or maybe using an API. But the reason why we recommend using a bot, actually more of a hybrid approach to be able to go to the website, is because there's just a lot more rich information that you can then use to be able to process your claim or follow up on that action afterwards.
Thank you, Ross, for clarifying that. The next question I have is for Sue. An audience member would like to know, how did you incorporate automation into your existing system?
Sure. So Olive is really an extension of your current staff. You onboard Olive just like you would for any other new hire, providing credentialing to access all of your host systems. Has access into our Envision system, into our McKesson document imaging system, into our other tools, our pricing tool, and also access to all of our shared drives so that she can go out and retrieve reports if necessary, if that's part of the process. So it's really seamless. And just one point to make there, it's helpful, at least for us, it was helpful to have an IT member assist us with that to get through any credentialing on the IT side that they control.
Thank you so much, Sue. The next question is also for you. It is, what hurdles did you overcome throughout the course of your automation program's evolution and maturity?
Also a good question. And hindsight's 2020, but going into the process with our eyes, pretty closed because it was all new to us. We really didn't have any expectations there. One of the things that was eye-opening for me is as we started to build processes, we found out that what we thought was working wasn't working, where staff actually created their own workarounds instead of reporting it as a bug or something wasn't working correctly in the system. They just created a workaround. So an example of that was when we were implementing the eligibility process and doing through HDX, Blue Cross being one of our major payers. We learned that they weren't using the HDX query and response because it was bringing back the wrong benefits for hospital. And so they, figured that out, and instead of reporting that again, they started going out to the portal and doing it through that process. And, we started questioning that, and then we had to go back to HDX and Blue Cross and get that fixed. That was one example. I think another example is, again, once the staff really figured out, there's impact to their jobs, it was important for us to be transparent up front and to have frequent town hall meetings, particularly in those areas that were being impacted. So we promoted this with an opportunity for them to bring more value to the table by working things that required more skills and giving them an opportunity to learn new things. So, we had a strategy for our staffing augmentation that we put in place that allowed us to backfill openings with temporary staff, knowing that they were going to be impacted from this transition. And then what we did is we promoted the other openings that weren't being impacted to our internal teams that were being impacted, and gave them an opportunity to bid out on other jobs and provide them the training and skill sets they needed to be successful. So that was received in a very positive manner versus, it could have been very negative had it been done differently. And I think thirdly, if I had to put them in order, is, again, keeping your IT partner close by. One of the things that we learned, through trial and error is, IT runs programming and scrubbing through the night, doing some of their changes and bringing the systems down and that we didn't account for initially. And we would come in the morning and see where it kicked Olive out and found out that was that. So we had to schedule that into the Olive process. So that was really important as well.
Thank you so much for sharing some of those examples, Sue. The next question is, have other Olive customers piloted automation prior to scaling? How was their experience similar or different to Medstar's? And Ross, I'll have you tackle that one.
Mm-hmm. Yeah, I know we're running short on time, so I'll try to answer this relatively quickly. But the short answer is yes. There are definitely other customers that we've worked with that started with one automation platform, and maybe it's typically people that are more in that middle box for the launch program. They're still between 1 to 10 bots, and then they realize that either they're not mining the processes and finding the best processes up front, or they're having issues with really being able to keep up with the maintenance, that then they'll say, well, this isn't really working. We got to find another approach. And so then they'll start talking with us, and we'll figure out a way to be able to help get the program turned around, so to speak. But even outside of my experience with Olive and working more on the consulting side, I want to make a very clear distinction between piloting automation versus doing a proof of concept. So piloting is when you actually have a bot in production. It's using live data, and you're able to really gauge the effectiveness of that bot at the end of the day, because again, it's in that production environment. You've done all the build, and then now you're just monitoring it to see what kind of maintenance is required and the impacts it's making. So that pilot is kind of that middle bucket there. The difference between that and a proof of concept is, a proof of concept is you're doing a segment, it's a very short piece of a process typically, and you're usually in a test environment. You're not touching production data, and that's where I've seen a lot of folks really get hung up. To be honest with you, there's really not a lot of value, in my opinion, that you're going to get from a proof of concept. They were more important and popular, I'd say, a couple years ago, when bots and using RPA was less proven. So people wanted the confidence to know, is this really going to work or not? So a proof of concept made sense back then. But for those that are considering doing a POC or a proof of concept now, I would really warn against doing that, because I think it's just going to add time. You're not really going to be able to get the insights if you're comparing two different RPA products, one versus another, to be able to get actionable insights from it. And ultimately, I think it'll just slow you down, to be very, very honest. So I'm happy to talk more about that offline, but there's a big difference between pilot and trying and putting in production versus a POC, where you're just testing out that technology to see if it works.
Great. Thank you. That is all we have time for today. I want to thank Ross and Sue for their excellent presentation, and Olive for sponsoring today's webinar. Enjoy the rest of your day, and we look forward to having you join us for future webinars.